This segment sponsored by GBMC Healthcare.
Now, there are many types of cancers, and today we're talking about that of the head and neck. Now, it's estimated that roughly 65,000 Americans will develop the disease just this year. Here to tell us more about this widespread condition and treatment options is GBMC's medical oncologist, Dr. Ari Elman. How are you?
I'm good. Thanks for having me today.
So tell us, what causes head and neck cancers?
Well, there's a few things that we've known for a long time cause head and neck cancers, such as tobacco, smoking, chew tobacco, as well as alcohol. But more recently, we've come to recognize that a lot of these cancers, especially the ones higher up the back of the throat, are caused by the HPV virus, the human papillomavirus, which we've known for many years causes cervical cancer in women.
Wow. So is there any way that we can prevent it?
Oh, absolutely. Well, in terms of tobacco, obviously,
Right.
quit smoking. Easier said than done, but important to always do if you can, and cut back on drinking. And in terms of HPV, now there is an effective vaccine that was formerly recommended just for children and young adults up to the mid-20s, but now the indication's been expanded up to age 45. So if you're not vaccinated yet under age 45, definitely go for the Gardasil vaccine to help prevent head and neck cancer, among others.
Okay, did not know that it had been extended, so that's great information. Can you talk to us about some of the treatment options that are available if you are diagnosed with one of these cancers?
Sure. Actually, head and neck cancer, when it's localized, is one of the most treatable cancers, in fact, curable, as long as it's localized to the head and neck. Once it's spread, typically we've managed that with chemotherapy, but more recently now we've had immunotherapy added to our arsenal of treatments.
Okay, now you talked about both of those. Are there any kind of clinical trials that people should look out for?
Oh, absolutely. There's always clinical trials opening and closing at all institutions around. We also have clinical trials open at GBMC, particularly for head and neck cancer.
So what is immunotherapy? We've all heard of chemotherapy, but what is immunotherapy?
So that's a great question, Brandy. So the way I always like to explain immunotherapy to my patients, I always tell them a story about one of my mentors who has a very thick foreign accent, and he used to say to us, "Why did your mother not kill you when you were in her belly?" And we always looked at him exactly with that face that you're giving me right now. And what he was saying was that you are a foreign body to your mother. It's because you're made half by your father. And the mother did not attack the baby. And we didn't understand that why for many years until about 15 or 20 years ago when they discovered these markers that the baby makes on its cells to protect itself from the mother's immune system. And once they found that, they looked at cancer, and it turns out cancer makes the same markers on its cells to protect itself from our own immune systems. These newer drugs then block that interaction, and then the immune system wakes up and says, "Hey, that shouldn't be here," and then goes and attacks the cancer and hopefully eliminates it.
Can you combine them? Immunotherapy and chemotherapy?
Oh, absolutely. There's already an approval for lung cancer, and now there is also an approval for head and neck cancer in stage 4 head and neck cancer to combine chemotherapy and immunotherapy.
Okay, now there is a drug that starts with a P. I'm not even going to try to say it, right?
Pembrolizumab.
There it is.
We could just say Keytruda. That's the brand name.
Okay.
So Keytruda is that drug that is approved now for head and neck cancer when it has already spread, that we can use either by itself or combined with chemotherapy, depending on the clinical situation.
Okay, so I guess what is the takeaway from today's conversation? Because you hear cancer and it's really scary, but you're saying it doesn't
absolutely.
have to be.
No, it is scary, and we recognize that, and it's important to recognize that in our patients. But we're here to be with our patients on that journey and to recognize and try to explain to them that a lot of times cancer is always is a highly treatable condition, particularly head and neck, and oftentimes can be curable, especially in the early stages.
What are some of the symptoms?
Head and neck cancer, if you ever find something in your mouth or in your throat that shouldn't be there, if you feel, sometimes men tell me, "Oh, I was shaving and I felt a lump on the side of my neck." Oftentimes that could just be a sign of infection like strep throat, but if it persists, then it's worthwhile to go see your doctor.
Any other prevention tips?
Live a healthy lifestyle, other than the quitting smoking and drinking and vaccination. Pay attention to things, don't ignore them. When you see them, don't be a hypochondriac on one side. But like I said, if you feel something that's been there for, I'd say, greater than 3 to 4 weeks, you might want to get it checked out.
Well, thank you so much. And if somebody wants to
pleasure.
get in touch with you, where can we find you?
You can find me at GBMC, the medical oncology, which is 443-849-3051.
And then we can always also go to the website, right?
Absolutely.
And you specialize in head and neck cancers.
I do, yes.
All right, Dr. Elman, thank you so much for being here with us
Thank you for
today.
having me, Brandy. Appreciate it.
Well, speaking of